founder and producer of Technical Veterinary Learning Channel, Professor Ahmed Mamdouh Sharif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Bani Suef University, presents today Technical Veterinary Learning Channel. These days, since 10th of October 2023, the occupied Palestine is distracted completely, especially in Gaza Strip, by tons of bombs that come from airstrikes of the occupying soldiers of Zionism. Egypt support Palestine. Egypt support free Palestine from the river to the sea. Palestine, in the name of God, will be free. منذ 10 من أكتوبر هذا العام 2023 تقوم طائرات جيش الاحتلال الصهيوني بدك فلسطين وخصوصا قطاع غزة وإيقاع عشرات الآلاف من القتلى بين الأطفال والنساء والشيوخ والمدنيين العزل. إن مصر تدعم فلسطين. مصر ترتبط بالقضية الفلسطينية ارتباطا وجوديا. مصر تدعم فلسطين حرة مستقلة من النهر إلى البحر. فلسطين بإذن الله دائما حرة. We will speak today about lumpy skin disease. This lecture will be in 3 parts. This is the first part. Lumpy skin disease, or LSD, have mainly 4 other synonyms as the following: pseudo-urticaria, Netling virus disease, Exanthema nodularis bovis, and Knopf vasculitis. These synonyms come in the ancient time according to the clinical signs in case of pseudo-urticaria, come to the causative agent in case of Netling virus disease, and clinical signs with name Exanthema nodularis bovis. Knopf vasculitis is the German name of this disease. Lumpy skin disease is a highly infectious disease in endemic areas, but it is a contagious disease in epidemic areas. In endemic areas, the animal shows subclinical and chronic stage of the disease. In epidemic areas, the animal will show acute, subacute, and some cases will be chronic. This picture is taken from the epidemic reported in Egypt at 2012. We see that cattle with enormous skin lesion of lumpy skin disease. Economic importance of lumpy skin disease. This disease is very important. In endemic areas, it causes severe emaciation, lowered milk production, and extensive damage to hides, while in epidemic areas, it causes abortion, secondary mastitis, loss of fertility, lowered of milk production, as well as extensive damage to the hides. The case fatality and the case mortality of this disease is very high in epidemic areas, can reach to 80% in epidemics that reported in Egypt at 1989, 2006 and 2012, it reached to 40% of the whole total animal population. Zoonosis of lumpy skin disease. Before 2014, lumpy skin disease is not a zoonotic disease, but first cases noted since 2014 as it is a zoonotic disease. Lumpy skin disease virus infection in leg of human patients showing severe lesions as edema, ulcers and nodule, and this picture explains that. So please, for all veterinarians, students, researchers and specialists, please keep in your mind dealing with infected or suspected animal to be infected with a complete precaution, as it is become a zoonotic disease. Lumpy skin disease virus human infections. Skin lesion showing vesicular exudate with brick-shaped virions ranged in diameter between 139 up to 183 nanometer in diameter. This appear in the picture that taken under electron microscope, where the viral particle segregate around an electron dense larger appear here in the center molecule with width about 511 and showing the M4 and the textured surface structure of non-enveloped particle outer membrane. This is a negative staining in case of electron microscope. Diagnosis of lumpy skin disease. Diagnosis of lumpy skin disease will take several steps. The first one, and an important step, is knowing its epidemiology around our areas and all over the world. Pathogenic risk factor. We seen in this picture the brick-like shape of lumpy skin disease virus that taken by electron microscope in an infected lesion. Lumpy skin disease virus classification. The picture showing lumpy skin disease virus with blue color in the tissue, take red color with evacuation, and the antibodies is taken the green line. Lumpy skin disease virus, Relam Vridanaviri, Kingdom Bamofordivira, Phylum Nucleocytoviricoda, Class Pocoversitis, Order Chaetovirialis, Family Poxviridae, Genus Capripoxviridae, Species lumpy skin disease virus. This shape explains the prediction diagram of lumpy skin disease virus structure. The surface of the virus is enveloped, which contains some entry-fusion complex. This is taken the green color in the second layer in this picture, while the surface of enveloped virus showing many surface of microtubule, which taken the violet color in this picture. The core of the virus is taken the blue coloration, which contain the genomic structure of the virus. The prediction diagram of lumpy skin disease virus structure mode, also in this picture, showing mature virion of lumpy skin disease virus. Sometimes mature virion is surrounded by a lipid membrane. It is the envelope. The envelope that taken here, the yellow color, is lipid membrane derived from the endoplasmic reticulum, and the virus contain lateral body appear here with the gray color, and capsid V taken the brown coloration, and the core, as we said in the last slide, taken blue coloration, which denoted to the genomic structure of the virus. Occurrence history and geographic distribution of lumpy skin disease. This map explains the distribution of the virus up to 2023. The disease mainly originated in Africa and subsequently spread to European and Asian countries. Transmission route is based on the time and location of lumpy skin disease, which reported by OIE in past 2 decades. First of all, it beginning in the Africa at 1929, distributed to the surrounded area through years of 1945, 1947, 1956, and then transmitted through Saharan, reached to Egypt and Libya at 1988, and then to Europe in 1913, in occupied Palestine at 1989, and then to Iraq and Turkey, and at 2014 to the India 2019 to the east of Europe, Russia, and Balkan countries 2016, and then entered China 2019 up to 2023, also reported in Russia. Lumpy skin disease recognized for the first time in northern Rhodesia 1912, 1943 and 1945, where it caused the largest epidemics ever recorded between cattle, as it infected about 8 million animals at that time. At 1929, Southern and Eastern Africa have been affected. Lumpy skin disease spread to Central and Eastern African countries in 1956, then at 1970 spread through most of Western Africa. This is a picture of multiple nodules present at neck and at the chest and scapular area of an affected cattle. Lumpy skin disease reported for the first time out of Africa in 1989 in occupied Palestine, and then resurgence in Africa at 1990. Lumpy skin disease virus is actively spreading within and from the Middle East, with cases confirmed in Kuwait 1991, Lebanon 1993, United Arab Emirates at the beginning of the millennium, Kingdom of Bahrain 2003, Oman at 2010, Turkey and Syria at 2013, Jordan 2013, Iran and Iraq 2013, Azerbaijan and North Cyprus at 2015. The picture showing multiple nodules on the lower jaw, head, dewlap, abdomen, chest, legs of calves during epidemics. This is a complete real picture demonstrated in whole countries during epidemics, including Egypt. Lumpy skin disease, as in this picture, reported in Europe since 2013 and become endemic in Central of East Europe and Russian countries. Lumpy skin disease confirmed in Egypt as epidemics in 1988, 2006, 2007, 2012, 2014, and be endemic now, with last appearance in summer of this year 2023. This is a picture from the epidemics reported by me at 2006, where lymphadenitis appear here as enlargement of pre-scapular lymph nodes with multiple nodular eruption of lumpy skin all over the whole body of this infected cattle. Sheep, goats, and African buffaloes, as well as wild ruminants, are involved in maintenance of lumpy skin disease virus cycle in the nature. Morbidity and mortality of lumpy skin disease virus. Morbidity and mortality rate depends upon virus virulence, animal susceptibility, and hygienic condition in the area. This is a picture of a cattle during epidemic of Egypt at 2012, show eruption of skin nodules that distributed all over the whole body. Morbidity rate in endemic areas reported around 3% and reached to 85% in epidemic areas, while mortality rate in endemic areas is around 1 to 2%, while mortalities reach to 75 up to 85%. In Egypt, the mortality rate during all the epidemics past 1988, 2006, 2012, and 2014 reached to 40%. Origin of infection and the transmission of lumpy skin disease. There is no carrier status in case of lumpy skin disease. Spreading of lumpy skin disease virus related to movement of infected cattle from areas to another. The virus can survive up to 38 days in desiccated crusts, as appear here in this picture. Primary or main route of the infection is direct contact, and this reported in endemic areas where mosquitoes, ticks, biomia, Culicoides, Glossina, and Musca species transmitted the virus, as appear here in picture. When mosquitoes put the virus in the bloodstream with other irritant material to sucking blood and then transfer it to another animal. Lumpy skin disease transmission cycle. There are two routes, short one and long one. The short one is coming directly from infected vectors, mosquitoes, musca, and ticks, that carries the lumpy skin disease virus and transmit them directly to the healthy cattle. Long route transmission cycle take several ways. First of all, transmit the virus from infected cattle to vectors and change them from free vectors to infected vectors. The second way is by transmitted the virus from infected cattle to reproductive material and contaminated equipments. And then these reproductive material and contaminated equipments will transmit the virus to healthy cattle by contact. Also, infected cattle transmit the disease during their wandering to a healthy stocks. This diagram of transmission mode of lumpy skin disease and this picture shows propagation mode of lumpy skin disease virus mode intensity. It comes from infected cattle during epidemics, which show the whole size of the disease through infected vectors, mosquitoes, ticks, and musca to healthy cattle, or through infected cattle and infected semen to healthy cattle, or during long transportation, either through vehicles or through ships to healthy cattle, as well as during heterogenic transmission by injection of contaminated syringe to healthy cattle. All of them will lead to transmit the disease during epidemics. Minor route of lumpy skin disease virus transmission reported in epidemic areas through saliva, nasal and lacrimal discharges, milk, semen, and open muscles. Number 5 is the animal risk factor. Cattle, buffaloes, sheep, and other ruminants. Recently, we discovered that recently recovered animals are immune for about 3 months. All ages and types of cattle are susceptible to the disease. Very young calves, lactating dams, and malnourished cattle develop more severe clinical disease because of the reduction of their immunity. British breeds, both in numbers affected and the severity of the disease, particularly the Channel Island breeds, are much more susceptible than Egyptian Baladi Zebu types in epidemic areas, as the immune system of Egyptian Baladi and Zebu cattle are more activated and taken the infection before, either during natural and change to subclinical or by vaccination, even for once, than those coming and exported from these countries. Typical skin lesions without systemic disease have been recorded experimentally with measles virus in sheep and goats, and natural cases of lumpy skin disease were recorded in water buffalo, Papulus papulus, during an outbreak in Egypt in 1988, as appeared in this picture. Morbidity of lumpy skin disease in water buffalo was much lower than those for cattle and reached to 1.6% in epidemics, then 30.8 in epidemics in cattle. Wildlife species are not affected in natural outbreaks with lumpy skin disease. There is concern that wildlife species might be the reservoir hosts in inter-epidemic periods, such as African buffaloes, gazelle, giraffe, and etc. Lumpy skin disease could be produced experimentally with methylene virus in giraffe, impalas, and grand gazelle, but wild beasts were resistant for this experimental infection. Dental transmission can be achieved with grouped up nodular tissue, blood, or virus grown in tissue culture that given by intranasal, intradermal, or intravenous route. And this is the shape of sheep lumpy skin disease on the face, around the eyes, and in frontal sinuses, as well as under the fatty tail. Although lumpy skin disease is characterized by generalized nodular skin lesions, less than 50% of natural or experimental infection develop generalized skin nodules, as in case of natural infection in epidemics. The length of viremia is not correlated with the severity of clinical disease. Environmental risk factor. Outbreaks tend to follow waterways, by mean that extensive epizootics are associated with high rainfall season as well as high levels of insect activity, with peaks in the late summer and early fall. Introduction of new animals and commensal grazing have been identified as an important risk factors for lumpy skin disease infection in epidemic areas. This is noted in all latter of Egyptian epidemics at 1988, 2006, 2012, and 2014. These outbreaks reported directly after introduction of newly animals through importation from infected areas. Keep on the track for following up the rest two parts of lumpy skin disease and all the infectious diseases on this scientific channel.